rolling. Great, thank you for doing that. I know a lot of people were interested in getting to hear. Good morning, this is Leigh Howard. I'm joined on the phone by a number of people. I see there are 48 folks on at the moment. Specifically from my staff, we have Lauren Whitley, who is the new Eastern PACOC staff person, Sierra Carnes, who is the Western PACOC staff person, one-by-one staff. From DCED, we have Brendan, and then we also have Donna Enrico joining us this morning, and we're going to get rolling here. A couple things just to go over. One is that in order to ensure that folks, whether they were on the call or watch the recording, now that we're going to have a recording or not, we're trying to pull together a document that we can update each week that's going to pose the questions from you all and on Workplace and anywhere else that we get questions from, along with answers, and keeping that up to date. That way, again, folks who are not available to join these calls or whatever have access to the same information. If you have other suggestions or needs, let us know. We're just trying to make sure that we provide as much information in as many different ways as we can, so it's accessible to you all. Today's focus, really, we're going to focus on mostly on some questions that we've gotten both during the last meeting and since, and then through the portal that we have established for submitting questions at any time. And so there's a few questions in particular we're going to go through, and then we're hoping to hear again from you all about what your needs are, what your questions are, etc. And so a couple questions that we're going to go over. What can community development block grant funds be used for, and how do we access these funds? So during the first office hours call on Monday, I mentioned that $5 billion nationally had been set aside for CDBG, and we're going to talk a little bit about that based on what's known at this point. Next, what funding sources can be used to cover hotel rooms? Third, what resources can we tap into for providing food while providing shelter in hotels and motels and other non-shelter type locations? How do I connect with my emergency management agency? And then just to talk, sort of like take a step back for just a minute to talk about if you're a housing provider, what the response would look like based on your role, whether you're a housing provider, you're a member of the community, you operate a shelter, and really collectively what this results in terms of a community-wide response. So we're going to get through those things, and then, like I said, have some open discussion time. As I mentioned last time, if you are not speaking, if you can put yourself on hold, you can always type in questions in the chat box at any point. You don't have to wait until the end or anything like that, but we will try to get, circle back to all the questions. So what can CDBG funds be used for, and how do we access those funds? Good question, and to answer those questions, or as much as she knows, we've asked Donna Enrico from DCED to be on the line today to sort of talk us through that. And so she has about 15, 20 minutes max available. So make sure, don't hold the questions related to CDBG to the end, please, because we want to make sure that Donna is available to answer those. And I know she has to jump off for another call. So Donna, take it away.
Thank you, Leigh. And I will say, if there are other questions that come up that I'm not available to answer, I certainly can get with Brendan to follow up, and then you folks can put those out. So let me tell you about that first $2 billion that HUD has allocated. It came by way of their formula. So when I talk about this, I'm only going to talk about DCED's program. DCED, the state is receiving $24,691,407 for distribution to our entitlement communities. And when I say our entitlement, these are municipalities that deal directly with DCED for these HUD funds. HUD also has directly granted money to the larger urban areas such as Philadelphia and Pittsburgh, Allegheny County, most of the counties in the eastern part of the state around Philadelphia are what we call direct HUD entitlements. They receive their monies directly. So I cannot give you direction on how to apply for those funds, but if you're covered by DCED's 50 rural counties, I can tell you how to apply for those. And it does have to go, this $24 million will initially go through the state's formula allocation. We have an act out there, Act 179. It was developed back in 1984, and we have a formula that we have to distribute this first tranche through. So we have to contract with units of local government, and they know who they are in that entitlement piece. And if there are service providers or anyone who's dealing with the COVID-19 issues, you would have to go to those counties to discuss your needs. We have gotten just little information on some examples of eligible activities. We're still waiting on HUD for some additional direction. But initially, they had put out a sort of a two-piece quick guide to eligible activities, and they talked about public facilities, doing some building improvements where we could construct, test, diagnose, treatment facilities. So saying that if somebody was in need of that, we could use the funds to construct. Rehab community facilities to establish infectious disease treatment clinics. So they talked about things of that nature, and I can provide the link for everyone to go into that. Assistance to businesses for special economic development activities. We can also use our funds to assist businesses for expansion or creation to, for instance, manufacture medical supplies necessary to respond. One of the things I want to make clear is that anything that I go over here, HUD has made it clear that there must be a connection to the COVID-19 crisis in anything that we meaning our municipalities apply for and are eligible under the CDBG program. They also certainly public services are going to be a big piece of this, we believe, where they have given examples of providing equipment, supplies, materials necessary to carry out public services, provide testing, diagnoses, and other services at fixed or mobile locations, talking about dealing with people who are being tested, etc., for COVID-19, delivering Meals on Wheels to quarantined individuals or individuals that need to maintain social distancing. One of the reasons we believe that we'll have a lot of public service activities is that in the traditional CDBG program, HUD has a statutory limit of only using 15% of the funds towards public services. We do know that under the COVID-19 CARES Act, that cap has been lifted. So there is no limit to using dollars for public services. And then there's a piece where it says we could do some planning, capacity building, and provide technical assistance. That's all in the act. That's usually administrative dollars. So as far as DCED and the program that we will be administering, our local governments will know what their allocations are because we're only getting $24 million. And for those of you not familiar with our small entitlement program within the state, we have, I believe it is 202 entitlements, meaning they get an annual allocation from us through the CDBG program. So the the allocations to them are not going to be great, but they will. Right now we're working on an application process for them to come in with. It will be a very truncated process. It will be very quick. We're hoping to get the monies out as quickly as possible by streamlining our processes. But HUD has still yet to provide us with guidance on a number of issues that are in the CDBG program itself. For instance, one of the statutory rules, so we have eligible activities, that's sort of one of our tests. The second test is we have to meet a national objective. And the national objectives are benefit to low and moderate income persons, removal of slum and blight, either on a spot or a area basis, and then on urgent need. So we certainly know that these activities will need to either meet the low, mod, or the urgent need. Our questions to HUD, and this has been all of the states are pushing for this, is that right now the program rule is 70% of the monies have to go to benefit low and moderate income persons. And that only leaves 30% of the funds going to what we would classify as an urgent need. That makes it difficult to get on the streets quickly if they do not change that percentage. And so we the states have been lobbying. We haven't heard anything from HUD on that particular issue yet. So those are the things that we continue to see if there are waivers out there that they will consider for the national objective test. A lot of our communities don't meet overall low mod. As far as I know, the COVID-19 hasn't picked only low and moderate income persons to impact, even on the business side of it. You know, when we talk about assisting businesses, you know, with job creation or retention, you know, a lot of businesses have been impacted out there, which are causing a lot of trickle-down effects for our constituents. You know, it's not on by income level. So it's frustrating for us that we may be stuck with having to meet that requirement at such a high level. But as I said, HUD did say there are some additional waivers coming out. They haven't told us what they are. So that's where we are right now. I certainly will entertain any questions that are out there, or if you want additional information. That's about all that I have at this point.
One of the questions that was entered into the chat box is the funding limited to the 2-page document?
I have to say I do not know. I want to say that I think there might be some other things that they will expand upon, especially in that public services realm. But I guess I would ask, what else are they thinking as an eligible activity? Because these are kind of broad in the public facilities, economic development, public services. There are lots of things that we can do under those, but those are the primary ones that I think HUD has initially said, yes, we can do these as examples.
So do folks want to pose anything that they've been thinking about in their community for the use of these CDBG CARES Act dollars? There's also a question, is there an allocation for Monroe County that will come from the DCED allocation? There's not a direct allocation from HUD to Monroe.
Yes, Monroe County is one of the counties that is Pennsylvania gives an annual allocation to. So yes, they will be receiving an allocation through this CARES funding under the CDBG program. And I believe, but I'm not certain, that they may have a smaller entitlement. I don't have all my tools right in front of me, but Stroudsburg Borough may also get a small amount if they're still one of our entitlement communities.
Yeah, they weren't listed. I just posted it in the chat box of who gets the money directly from HUD. And there are a number of communities, Allentown, Altoona, Berwick, Bethlehem, Bloomsburg, Carlisle, Chambersburg, Cumberland County, Johnstown, Lebanon, Lehigh County, Northampton County, Sharon, State College, Washington and Westmoreland counties, and Williamsport.
Yes, when you said Lebanon, Lebanon City is a direct HUD entitlement. We give monies through the county.
Right, right.
Yes, and I'm pulling up my paperwork here. It's interesting, my little filing system I have. Monroe does have two what we call smaller entitlements, East Stroudsburg Borough and Stroudsburg Borough. So those dollars that would be also allocated to those two small municipalities will go through the county as well. So the county will receive its own allocation, and then those two smaller municipalities will also receive an allocation.
Donna, can you say those two again? Because they weren't listed on the HUD document that I pulled these other numbers from. So I just want to go back and look them up. East Stroudsburg, and what was the other one?
Stroudsburg. Now remember,
Stroudsburg.
Right. So what you read off of was that those are communities that receive their funding directly from HUD.
Correct.
And so the 50 counties that are not listed there, we give an annual allocation to, but within some of those counties, there are smaller municipalities under our Act 179 that also receive an annual allocation, and the two in Monroe are East Stroudsburg and Stroudsburg.
And is there a list of that we could include somewhere?
Sure.
In our Q&As, that would be great.
Yes.
Because I didn't have those listed. And is the allocation to those additional communities that you're referencing under the Act 179, is that formula based or is it based on something else?
It is a formula base right now. Yes.
Okay.
And I can provide that listing. Would you like for me to provide it to you and or Brendan? That'd
be great. Yeah, if you want to send it to both of us, we can get it posted on the workplace for folks now and then reference it and then in the Q&A document that we're creating.
Yes, and I just want to caution at this moment, I cannot release the allocation numbers yet. That will come from our front office, but I can give you a listing of the communities.
That's great. And then we can update it as the allocation amount becomes available.
Yes.
And is publicly known. Sure. Great.
And so, Leigh, the only thing that I would add at this time, too, because I'm looking at my clock and I have to get on an 11:30. As part of that allocation, there will be what we term a discretionary pot of funding, competitive. And my numbers for the competitive is there will be $2.8 million available for our counties and some of these other municipalities that are not direct HUD entitlements to come in for additional funding. And we don't, until HUD releases more information on what they require, I don't really have any guidance except to say that will be in addition to what the formula allocation is for those smaller municipalities. So there will be a competitive pot available. HUD has also...
Go
ahead.
Go ahead. Sorry.
The only other thing I wanted to say is one of the other frustrations we have is we have heard that there will be reimbursement permitted. And as much as we have been asking every week, what does that mean? We have gotten nothing from HUD yet on reimbursement. So there may be some costs that have been incurred by our communities and nonprofits and service providers that may be eligible for reimbursement, but we do not know yet.
Great. So I know you have to go in 1 second. I just want to repeat something to make sure I understand and maybe other people are clear. So of the $24.6 million that you guys received through the CARES Act, specifically for CDBG, some amount of that money will be, well, $2.8 million will be competitive, and then the balance of that, so approximately 21 and change million, will be based on a formula. Is that correct?
Well, I can give you the exact number. 20,987,655 is our formula. We do have a small amount for the state administering this, which is
Right. Okay.
803,742. So those three numbers together will add up to the
Got
24.
it. Okay. That's great. Okay. I think that's helpful for folks to have, even though the formula may not be the same formula that's been used previously. Maybe it'll provide some guidance as to what can be expected. I don't know if you need to jump off, and if you do, that's fine. I'll just quickly read a question. If you can respond, great. I thought I saw somewhere that CDBG could be used for rental assistance, shelter operations, potentially mortgage assistance. Is that an option?
We haven't seen that, and in fact, in the public services, direct payments to individuals are prohibited, but they do allow some temporary payments. They say up to 3 months to pay things such as rent and mortgage. So we will look into that. I know that we've gotten several questions, so that is something we have to follow up on as well. And I think as a service, we may be also able to pay for shelter operations, and I will confirm that.
Yeah, I read that on one of the HUD slides too, that rental assistance and cost of operating shelter would be considered eligible, but I don't know the details of how that money would get out or anything like that.
Right.
Okay.
So
Donna.
One last question, Leigh. Donna, what is our normal annual HUD allocation for the 50 counties?
The past year, I think it was 42 million.
Okay, that sounds great. I can work the math backwards then. Thank you.
All right, sounds good.
Thank you so much, Donna. We'll be in touch with any additional questions that are raised, and we'll be on the lookout for the list of communities that receive a direct allocation from DCED from you.
Yes, that sounds good. Thank you so much.
Okay.
Thanks,
you
Donna.
so much.
Bye-bye.
Bye.
Okay, so if we have additional CDBG questions, either Brendan or myself can certainly forward those on to Donna. In addition, once we have more information about either the formula or the competitive piece, and Donna can provide some more details on that, we can certainly ask her to jump on another call. She already indicated to me that she's happy to participate anytime that we know we need questions answered related to CDBG. So that's really helpful. Before we move on, are there any other questions before folks forget that they want to raise in relationship to CDBG? Were your questions answered? And if not, let's catalog what those are so we can follow up and ask Donna to be on again next week. Okay. We can certainly, there's multiple opportunities to submit those questions. So feel free to do so as they occur to you. Another question that we got, what funding sources can cover hotel rooms? We talked a little bit about ESG and utilizing those funds. It's my understanding that if folks need to move money around within their ESG contract, that DCD is open to that. So if you have money, but not in the right buckets, if you will, that you can use those dollars. Brendan, is there anything you want to either correct or add to that statement?
No, that's correct. We are allowing that flexibility. Typically, we've had a cap on the amount of shelter operations that you can have in your budget, but we have released that cap to align with HUD regulations that no more than 60% of the budget can be in shelter. So we do have that HUD regulation in place, but other than that, our DCED restrictions have been raised. if you need to move money into your shelter operations budget, please send an email to Stacy Hawthorne. That's shawthorne@pa.gov. And that would apply for both 18 and 19 contracts. And 20. If you've submitted a 20 application and you need to revise it, get in touch with Stacy. But I don't think we have received any from, or at least not many from the Bounds Estate yet.
Great. I just realized one that I failed to list that I had a conversation about, which is HAP funds. There were some questions that came up from some communities saying that either they had dollars allocated within their homeless assistance program budget for hotel motel and they've already expended those, or they didn't have money allocated to that line item. And so this question was raised at the sheltering task force calls that are happening a couple times a week. And what was indicated is that you can request a waiver or a change. Those changes, the process to do that is outlined in the HAP guidelines, which are posted on the DHS website. I can try to find that link and we can put this into one of the Q&A document that we send out as another resource that's not listed here, along with that link. So basically what you would need to do is to get in touch with the organization that oversees your HAP dollars, talk to them about how to move those funds around to be responsive to your needs right now, and they'll need to contact the state. It's my understanding that folks are in the process of requesting waivers, and the state is looking at those. I don't know how quick that process is. Everybody knows there's emergencies happening, so is trying to move quickly, but I think we've all experienced fast not to be as fast as we would like it to be multiple times. So I can't speak to how fast that process is, but it is another resource. Next, county housing trust funds. If you have Act 137 dollars that are not allocated or perhaps have been allocated, and again, you need to sort of request a revision to those allocations. I know that's what some communities are using. Home for Good, if you received 2019 funding through the Home for Good, which is funds made available, you apply through the COC, but the funding is available from PHFA and the Federal Home Loan Bank of Pittsburgh. If you have a contract with them, you can certainly contact Clay Lambert to amend your contract to include COVID-19 related expenses. I don't know what the allocation of the funds will be, but we're expecting to hear over the next week or so about the 2020 Home for Good funds. That will be sort of block granted to the COC for the COC to make decisions about the best use of those dollars without having sort of the same type of competition that goes through PHFA as the last 2 years. The goal is really just to get money on the street as quickly as possible so that COCs have flexible funds to respond to COVID-19. Next, FEMA. I know there is some confusion about which folks are eligible for reimbursement through FEMA or PEMA. And based on the questions that I have asked and my understanding, and anybody who understands this differently should certainly correct me, but it's my understanding that in order to be eligible for those costs, the individual that you are sheltering in a hotel or motel needs to be isolated or quarantined due to a positive test result, or that they're awaiting test results and symptomatic. And so if those are the situations, if that is the situation, FEMA or PEMA can reimburse or cover hotel room costs. Next, county health department or the Pennsylvania Department of Health. and we'll go through that. There's some coordination, and I've got some questions sort of pending to folks based on one of the guidance documents that was put out through the Sheltering Task Force. It refers to reimbursement of particular items, but it's not clear to me who at times they're referencing. So more information or clarification to be provided as that becomes available. This is a terrible slide. Wow, I'm sorry. I don't know what it looks like on your end. Hopefully it looks better on the actual PowerPoint that's uploaded in Workplace. I can't even read it to you, but I can tell you what it says. It basically says, it's in the green, if your community or county has its own Department of Health, it's sort of those arrows that you can see there, outlines the process for how a hotel or some type of emergency housing is funded and arranged for people who need to be quarantined. The blue on the bottom is if your county does not have its own Department of Health, and therefore you fall under the Pennsylvania DOH Department of Health jurisdiction. And it's sort of walking you through there how that then occurs. It's important information if this applies to the needs that you're seeing in your community. If it's not readable, even on the actual posted PowerPoint slide, we can just post this document as a standalone to ensure that it is actually a resource there. In terms of which counties have their own health department, as you can see, the counties that are listed there, none of them are in the balance of state, but nonetheless, in case other folks outside of Eastern and Western are on the call, those are the counties there. In terms of municipal health departments, there are two that are in the Eastern PACOC, City of Allentown and Bethlehem. So the coordination there around emergency planning, around covering the cost of hotels for people needing quarantine, that needs to be coordinated with those two health departments as opposed to Department of Health, and the rest of you are going to coordinate with Department of Health. There was a question, we had a little bit of a conversation last time about food and resources for food for people who are in shelter, who are being sheltered in hotels and motels. What I can tell you is that there is a DHS feeding task force similar to the sheltering task force. I don't know if anybody on the call is part of that task force, but it is coordinated by Steve there, whose name is listed, along with his email address. I can tell you that Steve and I have had a number of emails exchanged over the last couple of days, and I am trying to, what I've asked of him and have not yet received is some type of contact list for each county or region or however they're organized that would say, if you're in, for example, Blair County, you should contact this person at this organization or these people at these organizations for assistance with food. I have yet to get that, but once I do, we will certainly upload it and make it available linked through the Q&A document. I've given you his email address there because if you have this issue in your community and you haven't seen the resource document posted, I would reach out to Steve and ask him directly. I'm sure he's not going to appreciate me suggesting that all of you reach out to him directly, but I don't know what else to do. Everybody's in crisis, and I want to give you the information that I have. So there we are. ESG funds, if you have shelter funding and you are providing shelter in motel and hotel, you can use your funding to cover the cost of food. I mentioned also FEMA. So within the requirements of who can be reimbursed through FEMA for hotel, if FEMA is covering the cost of hotel, there's also language around providing essentials like food, water, etc. I know on our last call, somebody mentioned, I think it was folks from Monroe, that they had folks from the churches who were no longer providing shelter through their family promise model, but that they were volunteering to provide the food for folks that were in hotels. I think that's a great idea. I've heard some other examples about local volunteers, sort of adopting, a family in a hotel and bringing them food each day, 3 meals worth, and making sure they have just some staples in the hotel room. That's another great idea if you have the capacity on your staff to coordinate something like that, or maybe even an enthusiastic community member who can coordinate some type of response to that. Tapping into the existing infrastructure programs in your community. And so if you have local food banks and other programs that are year-round providing food, obviously connecting with them. And then the last thing there is a link to organizations that are providing food at this time. Hunger Free PA and a couple other things are listed there, along with some local organizations that have indicated that they are still making food available. Those are the examples that we were able to find. I wonder if other folks have suggestions of how they have been securing food for folks who are sheltered in hotels or motels. And it doesn't actually have to be in a hotel specifically. It could really be in